Okay, let's try this again under 10 minutes. So, outpatient process. So, once I was done with the 8 weeks of IV ceftriaxone, I had my virtual with ID. It was with the fellow. Plans had totally changed from inpatient. Inpatient, we had talked about MRIs, we had talked about cultures of my port and peripheral. We had, that part was actually documented. The MRI was not, and neither was labs. They don't want to follow my labs because I have auto-inflammatory conditions and both the long COVID and the Yao syndrome, and never have a normal CRP-SR. But you can monitor the trends, and I can see the trends. And you can monitor the neutrophil lymphocyte ratio, look for a left to right shift. There are things that you can monitor. Procalcitonin, even though MGB does not let you do it outpatient anymore. But they could let my PCP do it. But they're, because I had a procalcitonin of 32. I really should have been in the ER like a week and a half ago. But I had an emergency appointment. I saw Dr. Hossman. I love him. He's amazing. Highly recommend. He has saved my life more times than I can count. Between him and Dr. Clonch. Dr. Clonch was part of the diazepam issue, but I understand why. He knew something else was going on, and he was scared of covering it up. So, I can understand that, because I'm kind of scared that I'm on all these meds and it's covering something up. So, I get discharged. I have an emergency appointment with outpatient pain management at this facility. That is very non-opiate, which made no sense because the whole time I was in the hospital, they were trying to push Vicodin over the diazepam, and I kept saying Vicodin's shutting down my GI tract. But outpatient, forget about it. So, inpatient, I told you, the day before they came in, well, the day of, actually, discharge, what turned out to be discharge, and came up with a whole new pain management plan. It was actually very helpful. But my PCP, because she felt like she missed something, which when we had our appointment, I was able to explain she didn't miss anything. We were working on incomplete information from Faulkner. Like, Faulkner didn't do blood cultures when everything went high, and they didn't do an MRI with contrast. So we were working with incomplete information. Even if I had gone in and seen her in person, it would have been the same treatment. And I'm pretty sure she's neurodivergent. And once I was able to explain that, she was willing to cover me until I could get in with local pain management. But their pain manager, their outpatient pain management, refused, even though it's 5 Vicodin, they will not do benzos and opiates together, and they don't take over pain management, even though it was their inpatient pain management that made this plan. Tell me how that makes sense. But anyways, neither here nor there. I have now an amazing pain management team. I'm happy. I'm getting a new palliative team. I'm happy. Everything's good. I'm switching home health. I'm never going back to the home health. That's a whole different other story. I'm just going to say neuroplasticity. The PTA came out and said, had I ever heard of sympathetic nervous system and neuroplasticity? I have hyperadrenergic pots. That's all I'm going to say. Everything I have could be cured by neuroplasticity. Thing is I do believe a little bit that it can help, but yeah, no, it's not going to cure me. Thank you. Tried it. Done that. Been there. Done that. Anyways, so I saw ID. They refused really any true follow-up, anything. And then when my PCP did it, slapped her fucking hand. because it was super high because I had had a PSH episode. I learned my lesson. Do not draw lab work within 24, 48 hours of a PSH episode, the same as like within 4 days of IVIG. And right now, while I'm so inflamed and off kilter, I cannot do IVIG close together. I found out the hard way. Because that's what caused the 3 PSH episodes. When my nurse Samantha finds out, she's going to be so upset that I didn't tell her before now. Anyways, sorry. The PSH episodes, when you have 2 severe ones with 106 fever, your brain gets a little fried, and my encephalitis is definitely up, so bear with me. So I saw Osman. He set me up with the osteomyelitis specialist. She agrees with everything they did, other than they didn't do weight-based dosing on the ceftriaxone. She mentioned the 6 weeks. I explained that the 6 weeks does not apply to me because of the fact that that study and that guideline is based off non-immune compromised and non-epidural processes or paraspinal processes. That's why we did the 8 weeks. And the 8 weeks was planned from the get-go. There's also other falsehoods in her note, like they didn't draw cultures, they did off my port, it just was too late, blah blah blah. Nice Neurosurgery called me, wanted me to go to the ER, but I forgot where I left off. I'm sorry, guys. Anyways, so I saw new neurosurgery that my autonomic PA recommended. They were very upset that the antibiotics were stopped before the end of the, before they did an MRI to make sure that the spinal epidural process was better, and not getting worse. But he was going on a medical, trip. And then the guy that wrote I vehemently was against neurosurgery in my chart then called me and apologized and recommended me go to the ER, but I was already in stretcher transport. So then I saw Dr. Hausman, and he got me in with the expert who just agreed with everything. If you're going to get a second opinion, go outside the system. That's my recommendation now. And so now my plan is go get the CAT scans because they won't do the HRCT in the hospital. And then if my pain is continuing to get worse, I'm going to call neurosurgery before I get there. Probably on my way when I'm in the van, and let them know that I've been having increased pain and the paresthesia and all the stuff that they're going to yell at me for. And then I want to get the CTs done, and then I'm going to call them afterwards and see if they can call down to the ER and explain that I'm coming in via stretcher transport. They cannot stay, and that I'm willing to take a hallway bed or anything, but that I can't sit up, and that can I please have a stretcher. So that is my plan if my pain continues to worsen or continues to be about the same and my mobility continues to worsen. So that's my plan. So that's Tuesday. Tomorrow's pain management. If not, hopefully I can make it to the MRI on the 16th. But I have a feeling I'm going to the ER on Tuesday because I'm not waiting. The lady wants me to wait until I'm to the point that I'm bent over and have to be lifted out of here like some 600-pound life shit. I'm not doing that again. I'm still dealing with medical trauma from that. So, good news, my own electric portable chair was approved by the waiver, and now we just have to wait for it to come in.